Welcome to Nurture Talks. Today we are honored to host Professor Jason Hall, Professor of Pharmacy Education at the University of Manchester. Professor Hall has an extensive background in pharmacy practice and education, with research focusing on prescribing decision-making, professionalism, and interprofessional learning. We are excited to learn from his insights. Hello, Professor Hall. It's a pleasure to have you here with us today.
Hello, thank you for your invitation.
Thank you. Professor Hall, you have worked as a community pharmacist, a pharmaceutical advisor, and now a professor of pharmacy education. What inspired your transition into academia, and how have these different experiences shaped your research?
I started off, as you say, in community pharmacy, and I enjoyed working as a community pharmacist. But I think the thing that I got most pleasure from was helping, teaching people. Teaching them about medicines, about services. And from there I decided that I wanted to become a teacher. So I went to teacher training college and trained to become a teacher. And then I moved from there to teaching pharmacy technicians. And that was a great job. I really enjoyed it. To get further, to kind of progress on, I realised that I needed more. And after a bit of work, I looked around and actually realised that to develop the teaching further, to be kind of at the sort of cutting edge, I needed research experience. So after moving around a few jobs to get the experience I needed, I moved to Manchester to do a PhD, and that was in non-medical prescribing. But it was a great opportunity because it gave me the chance to teach and also do research in the same time when I was studying for my PhD. And I've just stayed in Manchester ever since.
That's really inspiring. Manchester and Mansoura both have strong traditions in healthcare education. Manchester through initiatives like the Center for Pharmacy Postgrad Education, the CPPE, and Mansoura through its advances in digital learning. How can sharing these experiences lead to joint educational models that benefit postgrad students in Egypt and the UK?
Yeah, I think it's really very exciting. I think the opportunity to come together, with two great institutions with lots of experience. I think the experience we have developing different systems that are flexible, because with postgraduate we've got students from a wide variety of backgrounds, different experiences. Some study full-time, some study part-time alongside jobs. So what we're looking for is ways that will work, that will help the students develop the skills that they need to either develop their research or develop their professional skills to allow them to improve and work in their careers. And I think that different varieties and platforms is really helpful, that can produce education that meets the needs of a wide variety of people.
One of the areas where Manchester has been particularly influential is prescribing. Much of your research has examined non-medical prescribing decision-making. What are the most common challenges you see in prescribing practice, and how can education help address them?
Non-medical prescribing is a huge area. It started at the end of the last century, but it's a tremendous opportunity for patients to benefit from the skills of professions such as pharmacists, nurses, optometrists, and that's really useful. There are lots of challenges. I think one of the challenges is that the prescribers don't actually prescribe as often as they could, and I think they often lack the confidence to do so. And I think education can play a big part in helping support that development of confidence. So what we're trying to do here in all the work that we do is to help support their competence, so they become competent and they become knowledgeable, they've got the skills, but they've also got the confidence to make a big impact on patient care. And I think if you've got that confidence to go out there and think, yeah, I can really help patients here and I can make a difference, I think that's something which is really important, that we can start to do in all of our training, undergraduate and postgraduate.
I couldn't agree more. And of course, prescribing doesn't happen in isolation, so it often requires collaboration across professionals. You were involved in research on implementing interprofessional education across UK institutions. First, could you please explain what is IPE for our audience and then tell us how Manchester is applying it in pharmacy and health curricula?
Yeah, I've been working around interprofessional education for quite a few years now. I've always been interested in it. Interprofessional education is learning with other professions and about other professions. And the important part, I think, for there is it's learning as students. So it's not just pharmacists working with doctors, but it's pharmacy students working with medical students, nursing students, dental students. And if they learn together, then they can start to develop relationships and understand what the other professions can bring. And that's really helpful for the future, because in the future they will be working beside the other professions. And there has been barriers in the past between the professions, between different professional groups. And I think anything we can do to break those barriers down and improve working between the professions will only benefit patient care. I think it'll also benefit the professionals, because I think they will have, they will enjoy their work more. They'll get more from their work. They'll see, they're having greater impact on improving care. So it really works all round if we could try to improve the experience that the students have at all levels interprofessionally. We have a number of things that we do in Manchester around interprofessional. Some of the things we do, we've got our pharmacy students and optometry students working together, looking at common eye problems, and they can discuss cases and they can work out when we would when would the pharmacist refer to the optometrist, when does the optometrist think that the pharmacist could deal with that on their own. So those are simple exercises that the students will run together, but they learn so much from it. We have also placements where the pharmacy students go out and they're working alongside nursing students, and they can start to appreciate what the challenges are from the nursing perspective, and the nursing students appreciate the challenges from the pharmacy perspective. And we have lots of other ones too, with medical students and dental students. And all of these things really add to the experience of the students. The student feedback that we get, the students love this sort of thing. They love meeting other professions. They love learning about what their perspectives are and what their views are and their experiences. So it's enjoyable, but I think it has lots of benefits for the future, for patients.
Of course, and it increases their confidence and competence, the challenges that you were talking about previously. Yes. Alongside collaboration, technology is also reshaping how healthcare education looks today. Interdisciplinary collaboration across health, engineering, and life science is becoming essential. From your experience, how can pharmacy education be better integrated with fields like medicine, engineering, and agriculture under a One Health perspective? And are there models from Manchester that could inspire a Manchester-Mansoura partnership?
I think from work that we've been doing and the work that we explored, we found that actually where the leadership at the top of institutions, where that really promotes interdisciplinary learning, that's where we've seen the greatest benefits. You can get a kind of top-down or bottom-up approach, and both are effective, but the one where you get the leadership at the top, that seems to have the greatest impact in terms of long-term changes. So having leadership at the top, recognising that different professions working together can be beneficial, and that can lead to the longer-term changes that we see, that have seen the greatest benefits.
Perfect. With the rapid growth of AI and digital health, do you see technology as a tool to improve prescribing safety and decision-making for future pharmacists?
Oh yeah, I think definitely. I think AI is something which is here now. It's something that we've got to use. Students use it. There are sometimes we see that students using it inappropriately, and that's often not to their benefit. So I think students have to learn to be able to use AI appropriately, and it can improve their learning experience. I think in terms of prescribing, there's a huge benefit for patients if we use AI. We have had decision software for a number of years. I mean, I think 20 odd years now we've had prescribing decision software which can help. It's always been a bit clunky and a bit slow, but I think now with the developments in AI being much, much more rapid, we've got the opportunity to do things in real time, so that prescribers can access, the latest evidence, and they can get, support for those decisions, that evidence-based decisions. So yeah, I think there's a huge opportunity there. I think with prescribing, the key thing is still the patient to the health professional interaction, and that human contact is really important. So I think AI has the potential to enhance that, but we don't want to replace those human-to-human interactions. I think that's a key part. Patients love the human contact, but we've got to learn to do it in a way which is much more seamless and adds to the care.
Of course, technology is important, and as you mentioned, human values remain at the heart of healthcare education. Continuing with the IPE, why is it so important for pharmacy students to learn alongside other healthcare professionals, and what benefits does it bring to patient care and research?
Yeah, it's hugely important. You've got to understand what the challenges are from other professions, I think, to understand what their challenges are. And I think if you understand their challenges, it makes things much, much easier to work with them in the future. And I think there's always, people have a concern, I guess, when should I refer this patient on to the doctor, or should I deal with this myself? And that's a kind of uncertainty that many pharmacists would have. The more experience you have with actually working with the doctor, then the more you're going to feel comfortable about doing that when it's appropriate to do that. What are the danger signs that actually this means I have to refer on to this other professional, or actually this is something I'm comfortable dealing with myself. So having those interactions and be able to have those often informal discussions between professionals, that can really help those sorts of things, so that you're much more likely to make appropriate decisions.
Yes, of course, like having human interaction,
Yeah.
it's not only about books and like theories, having
exactly.
like on the field work, it's different. Yeah, couldn't agree more with you. So now looking beyond Manchester, at Notre, our goal is to connect postgrad students in Egypt and the Arab world with global expertise such as yourself. From your perspective, how can platforms like Notre support students in developing the skills and mindset needed for international research collaboration?
One is being able to have knowledge of what's happening, knowing what's happening where, and knowing, exactly who to contact, what someone's expertise in. Those sorts of things I think are helpful. So it's some sort of network signposting. I think that's very valuable in doing that. I think in being aware of what research is happening, and also any exposure to research skills and awareness of what's happening in the research world that's relevant to your field. I think all of that is really valuable.
And that's what actually we are looking for here in Notre. We always focus on like trending research topics related to our postgrad students to help them like improve the research and ranking of the university itself. So finally, to bring this all together, many of our postgrad students aspire to follow in your footsteps, combining research, teaching, and practice. What advice would you give them to build successful academic careers in today's competitive landscape?
Yeah, I think from my perspective, I think it's getting as much experience as you can in both of those areas in teaching. So whether you can help out with teaching, it doesn't always necessarily have to be in the field that you're in. There's a lot of volunteering which is available. Teaching is in many ways, similar in different areas. So my area also is pharmacy, but any sort of teaching that you're involved in, supporting in a school, in a college, helping out, people with their language or their mathematical skills, all of those things can be helpful. And if you've got that sort of experience, that's something which looks good on your CV or resume that you can use. And again, with research, being aware of things, but getting experience. Are there things that you can help? Are there projects you can volunteer with? Can you help, collect data for someone? Asking around, seeing what opportunities there are to gain experience. All of the things, I think, come down to trying to get experience. And then the other thing, in my job, when I'm looking to recruit people, what I want to see is people who are enthusiastic, that they want to do research, they want to teach. And if they've got that enthusiasm, that passion, those are things that they want to show. Show those things. Trying to get experience, show enthusiasm and passion for the subject. And that's, to me, what I think.
That's so lovely to hear. Thank you so much. Professor Hall, thank you for sharing your expertise and inspiring our postgrad students. Your insights on prescribing, professionalism, and education truly highlight the importance of bridging research with practice. This has been Nurture Talks, where knowledge meets the future.
Thank you.